just got the last panel. Can we make a round of big applause for all the panelists, the presenters today? And I will take the time to thank them after, but let me tell you, having all of these people in the room, it is normally very difficult, but all of them said yes easily, and I want to really thank them, and please, another round of applause for them. We have now, can we give them some microphones? You can come, please, on the stage. Come. Yeah, you have the mics there. We have students as note takers. They will just summarize what we have discussed during the day, 2 minutes each. And what I want you to know, in February, we take notes of all the events. We have two AI tools which were taking notes, and we also have the students who take notes. So in February, we will publish a report of that, and before publishing the report, we will consult you again on this to be sure, like those who were there today, if there are more to say. It is also important to be sure, like, you sign the Ottawa Declaration on Black Health. And before we start, oh, I'm sorry, because normally, okay, I know why they were there. I know why now. Let them have the presentation first, and then we will have a video from Senator Berry, because she talked about the event in the Senate. So I'll let you go.
Bonjour tout le monde, mon nom est Christian Pabois. Le premier panel a porté sur les déterminants sociaux. La modération a été faite par Dr. Howard. 2 présentations ont été faites, notamment celle des Dr. Omisore et Dr. Linda. Que peut-on retenir? Les communautés noires occupent une place importante dans l'histoire du Canada. Les principaux facteurs ou déterminants sociaux sont des 2 ordres, structurels et conjoncturels. Sur le plan structurel, les inégalités occasionnent les racismes, la pauvreté, l'insécurité alimentaire. Le racisme systémique est un facteur déterminant qui gangrène l'accès aux soins égalitaires. Les obstacles sont multiples, notamment la stigmatisation, l'isolement dans les systèmes et le développement d'un sentiment d'exclusion. Il y a également des inégalités du point de vue géographique. On retrouve de plus en plus des communautés qui sont situées ou localisées dans des régions moins servies en termes d'infrastructures sanitaires. Il y a des actions que les différents panélistes nous ont recommandé à prendre, notamment la nécessité de la reconnaissance du racisme comme déterminant social de santé, l'implémentation des politiques publiques qui favorisent l'égalité d'accès aux soins de santé, les renforcements des financements des recherches par et qui sont faites par et pour le noir, la nécessité d'une approche de collaboration conciliant la recherche ainsi que les communautés. Du point de vue de la santé mentale, il y a également les déficits par rapport aux données. Voilà ce qu'on peut retenir par rapport aux déterminants sociaux de santé.
Oh, exactly 2 minutes. And Christian is a PhD student in civil law.
Hello, everyone. So I'm just giving a brief overview from panel 2, which was focused
Introduce yourself, your name, and
sorry.
what you're doing.
Okay.
Yes, thank you.
Yeah, my name is Zakara Stamp. I am a PhD candidate at Western, focused in geography and environment with a specialization in migration and ethnic relations. Yeah, so panel 2 focused on the chronic and infectious diseases as well as the health of Black elders in Canada. And I just want to thank our moderator, Ms. Versailles, and our presenters, Dr. Shomien and Dr. Boego. So first, the data was very clear. Black people in Canada are facing higher rates of premature mortality, largely driven by chronic illnesses like cardiovascular disease, diabetes, stroke, and Alzheimer's. It's important to note that these disparities are not biologically inevitable. They stem from structural conditions such as unequal access to preventative care, delayed diagnoses, lower follow-up care, and widespread mistrust rooted in experiences of racism and discrimination. Chronic stress from racism has real biological effects, and immigrant Black populations are often facing added barriers such as language and cultural exclusion. We also cannot ignore conditions like sickle cell disease. It primarily affects the African and Caribbean diaspora, yet it remains systemically overlooked in Canadian health planning and research. Many patients have had their pain dismissed as drug-seeking, leading to avoidable suffering and delays in treatment. Even basic care like blood transfusions are hindered because of a historic lack of Black blood donors tied again to exclusion. To move forward, the panel emphasized the need for structural and community-based research, better data collection. My favorite was StatsCan should be oversampling Black communities, as well as explicit recognition of racism as a major social determinant of health. We also need stronger cultural competence and safety among service providers, and meaningful funding to support this work. There was also mention of Indigenous communities whose advocacy has paved the way for health equity movements for the Black community. The second theme focused on Black elders. Canada is an aging society, and we have little research focused on Black older adults. The systematic reviews that were presented found only 26 papers on Black seniors, and only 8 addressed major issues like diabetes and hypertension, despite these conditions being highly prevalent. So if we don't intervene now, the long-term healthcare costs will continue to rise. Many older Black adults experience what's often called the healthy immigrant effect, where good health deteriorates rapidly after arrival to Canada because of racism, barriers to care, and social exclusion. In the final discussion, panelists discussed the need for more Black family doctors, greater cultural competence among healthcare trainees, and pushing institutions, which are often resistant to change, to recognize the urgency of this work. Black seniors are currently missing many aspects of positive healthcare, and some choose to stay home rather than navigate a system that does not serve them well. But the community, our villages, are strong, and with the proper support, they can be a backbone for better health outcomes. So overall, the message is very simple. We need to address systemic racism, invest in research and culturally safe care, and strengthen community-based solutions to ensure Black people across the life course can live healthier, longer lives.
Thank you. Thank you.
Okay, so my name is Christina, and I'm a fourth-year nursing student at the University of Ottawa. So I will be reviewing panel 3. Oh, thank you. Thank you. So yeah, I'll be reviewing panel 3. So we had 2 amazing presenters, one of which is also from the School of Nursing, Dr. Josephine Atoa. And then we also had a lovely presentation from Dr. Simpson. So Dr. Atoa brought up some very valuable points regarding Black women's health and reproductive health. She highlighted that Black women in Canada face distinct and persistent health challenges shaped by systemic racism and intersectional discrimination. We can see that there are higher rates of chronic illnesses such as hypertension, diabetes, fibroids, which is something that we also discussed earlier, and cardiovascular disease. We also saw that there was huge breast cancer disparities. I just wanted to re-emphasize some of the statistics that were shared. So 26% of Black women diagnosed with late stage 3 and 4 versus 17% for white women. And there were a lot of points raised in terms of how we can address these issues, especially when it comes to things such as preventative care and doing earlier screening. And that was brought up during our panel discussion and during some of the questions that were asked. There was also mention of the Unheard Voices report, where we learned that, again, as I said earlier, Black women do report barriers to access, feeling ignored, misunderstood, stigmatized, and experiencing repeated discrimination. Another thing that was also mentioned was that cultural expectations of strength and resilience can prevent help-seeking behavior and leads to underdiagnosis. So there is the existence of the strong Black woman stereotype that also affects how we navigate just receiving care. Secondly, we also had a lovely presentation by Dr. Simpson. She started off by raising the question, are we all born equal? And she continued to proceed with the answer with not quite, because as we discussed throughout today, that some of these disparities even emerge from birth. We talked about the APGAR scoring and how there needs to be changes in the way that we discuss skin tone and how we can improve our language to be more inclusive when we talk about different diagnostic testing that evaluates the health and well-being of babies that are introduced into the world. Okay, let's see. There's also, we also discussed sickle cell disease being the most commonly inherited disorder worldwide, yet it remains understudied and underfunded in Canada. There's limited access to novel therapies and compatible blood transfusions. There are also a lot of research and data gaps regarding Black children's health due to the lack of interest, coordination, and funding. And there are very few Canadian studies that specifically examine Black children's health. And furthermore, there was a large emphasis on the need for race disaggregated data in public health databases. Some of the community solutions and recommendations that were highlighted was the Peer Equity Navigator Program. We talked a bit about some of the training that is led by foot soldiers that work really hard to get into hard to access areas to interact with communities. We also talked a little bit about the critical health and racial literacy training program that is led by Dr. Otoa. I can make a personal testament to that. My community health nursing class is a part of our curriculum to get that training done. In order to pass the class, I took the training, my colleagues in my nursing program has also taken it, and we've had wonderful discussions on the things that we've learned. So it's really cool to also see the integration of such training for different healthcare providers. And I'm getting a sign that I need to wrap up. So one thing I just wanted to mention before I leave, that we received a very, very powerful testimony during the, I forgot the name of the transition period, but I really do encourage the bridge. There we go. Thank you so much. During the bridge. So I really do encourage all of you to reach out to your MPs and support Bill S201. Write that down because it's a really important bill related to sickle cell disease. Thank you.
Thank you. 6 minutes, but really try to stay with 2 minutes. I hope you will be okay.
Okay. Hi, everyone. My name is Megan. I'm here today as a Master's of Nursing student at the University of Ottawa. I'm in my second year. Yay! I'm also a research assistant and an artist. So I'm going to be providing a summary of panel 4. So it was moderated by Suzanne Obiroa, and the first speaker was Dr. Canon Osei Tutu, who discussed the strategic importance of culturally relevant and anti-racist approaches, with emphasis on the recognition and nuance of the specific type of discrimination experienced by people attributed to African descent. Remember the first principle of Anti-Racism 101, it's simply to name it, even in the face of resistance and subjugation. We must learn to be innovative in our anti-racist interventions, which requires recognizing, using, and leveraging our power towards strategic and system-level change to transform systems from a place of intention to a place of action. He also mentioned reading Dr. Otoa's book and to support others that are pursuing this cause. The second speaker was Dr. Emmanuel Bernheim, who discussed dignity. Emmanuel affirmed that dignity is not a moral supplement, but a clinical institutional requirement and a fundamental right. Achieving dignity in care is about reclaiming humanity in health systems. It is important to recognize the historical aspects, such as colonial and medical legacies, that have normalized the dehumanization of certain human beings as we continue to witness and endure the cumulative and cyclical effects of this dehumanization. Respect and dignity are central components that must structure every policy or clinical procedure. We reviewed 6 principles toward dignity and care, and I'm just going to conclude by saying the future of health systems depends on the ability to heal without replicating the wounds of history. Thank you.
Okay, my name is Brittany, and I'm in my final year as an honors student in biomedical science. I'm also working with Dr. Awad on his research project. I'm going to summarize panel 5. Both speakers really emphasized that our research systems were never built with Black researchers or Black communities in mind, and yet we are still asked to succeed within systems that exclude us, misunderstand us, and underfund the issues that matter to our communities most specifically. There was one phrase that really stood out for me: opening doors and leaving them open for those behind. All of you guys are opening doors, allowing researchers such as myself to also have doors to follow through, and I'll hope to do that for others that follow me behind as well. This exclusion is not accidental. Review committees often lack understanding of Black cultural and political realities, and there needs to be change within these systems such that they could have a trickle-down effect as well. There were also 4 really key points that I took away from that talk. We need targeted funding streams for Black health researchers. We need mandatory anti-Black racism training for research committees. We need transparency in funding success rates by race, and we need a dedicated structural support for Black-led research as well. In our second part of panel 5, we talked about data governance. And we know that data shapes decisions, it shapes funding, resources, healthcare, and policies. But racialized data across Canada is often missing, inconsistent, and inaccessible by those who actually need it. The speaker reminded us that data is capital. It holds political, economical, and symbolic power. And if we have it, we can be able to impact change in our communities. Right now, many Black community members don't have access to the data that describes them. They often lack data literacy training as well. That limits their ability to participate fully in conversations about health and policy that directly impacts their lives. The speakers closed with a powerful reminder that governance and governing data is governing lives. And the governance of Black health data must be grounded in justice and solidarity as well. So thank you to each and every one of you who are opening doors for future researchers such as myself and allowing us to have the space to be brave, to be able to speak and share our experiences.
A round of applause for all the students who are note takers. Thank you again. And that will help us for the report. Thank you again. Let me first of all thank all the members of the Interdisciplinary Center for Black Health. During the day, many times people talk about, mention my name, but I have to say, without the leadership committee, the scientific committee, Josephine Etowa is our scientific director. And can I ask to the members of the center who are still there to join me, please? Idrissa, Josephine, Emmanuel. Who else I can see in the room? Oh, where is Sharon? Oh, Sharon, please come. Awad, all the members. Without all of these people, we cannot do the work, and sometimes I can just take the phone and call them. And Idrissa and I, we are working, sometimes we have, it is not a good example for students. I don't know if we can say sometimes okay. We got some calls at 1 a.m. sometimes because we have to advance something, but we have to be careful because even all we are doing, it seems we are still paying our Black tax, and we have to be careful of this. Let me thank 2 people. Without them, all of this will not be possible. Yuma, Konate, Krista, can you come, please? Our coordinators, come. People want to see you. they are the people behind all the organization of this and all the staff. I want to cite some name. Magda, Tadele. Tadele, can you make, because he was not from the note takers, but he was the boss of note takers. Tadele, he's our statistician. Magda, come. Magda Jean-Charles, our social mobilizer. Where is Schwab? The second social mobilizer of the center, please come. All of these people, they are going, without them, that will not be possible. I want to thank Dr. Cynthia Kiwoga. Cynthia, can you come, please? I know you want to take picture, but please come. She's the boss of the Alex Rebeck Forum for Dialogue, and they fund, it is the most important fund for this event. And thank you again, Cynthia. I want also to thank all our presenters, but before that, let me thank also the BHI, Brain Heart Interconnectum. We have a representative here, Mireille, and Jennifer just left, and we got funding from them also, and thank you for this. We got a last funding from PHAC, Public Health Agency of Canada. Thank you for this. We have some representatives there. And let me thank the presenters. And I want to insist on one thing. In the community, sometime in the Black communities, and sometimes it is very, we continue to pay our Black tax, and it is sometimes very difficult to work together because the way the system is done, it is very, very difficult. But each time I solicited these people, they are there. And I want to thank them. I want to also thank the community organizations because, as you saw, it is not just schoolers, but also people from the community organizations. And when we asked for the reading of the Ottawa Declaration, when we asked to be moderators, they said yes. And I want to thank all of these people. I don't want to see the names because I don't want to forget someone, but thank you for all of this. And we have calls from senators, from MPs, from community leaders. I can maybe say by the number of times I got called, you're supposed to do this, and how you do this. And Dr. Simpson is there. You're supposed to come. You are a member of the center. I'm sorry. Please come, Dr. Simpson. I'm sorry. We have this kind of connection with the community organizations, and I think it is something which is very, very, very important for us to have this connection. But let me thank all of you, and please do a round of applause for all people who are still there. I see in the room many friends from Nova Scotia, friends from Alberta, friends from Manitoba, and thank you for all of this. I want also to thank my dean, Dr. Nathan Young, and it is very important to say that the Faculty of Social Sciences is very supportive of the center, and also the other faculties, the Faculty of Medicine, the Faculty of Social Science, of Health Sciences, and even those who could not be there, they sent a word during the day saying, hey, or some just, they were there for 1 hour, and having all of this support is important for the center, and it is important to appreciate it and to mention it. But when I say together, and both during the day I said together we are the solutions, let me tell you, I really believe together we are the solutions. And I can see how people act when we are together. I can see how they act differently. When we have some meetings with some public agencies or governments, I can see when we come alone how they act, and I can see when we come together how they act. Let's be together. We have the Ottawa Declaration on Black Health. We can make it viral. Let's make it viral. Let's talk about it. And I will let you with a video, and you will see the impact of it. But it is just a starting point, and I think we can make the difference. And let's be together. Let's be the solutions, not just one person, not just one group. There is the center directed by Omisoye Dryden. Each time we connect, and I can see even the CBS, the Canadian Blood Services, when we were together, how they act, and where we are alone, how they act. And let's be together, because together we are the solutions. We have to enjoy the time for the cocktail, enjoy the time and enjoy your time, make connections, and again, let's make a round of applause for all of us, because we are the solutions. Thank you.